The medical condition called venous ulceration is considered a chronic condition that affects certain people across the globe. One major factor that needs to be considered is that there is a difference between a standard ulcer and a venous ulcer. A foot ulcer, firstly, is defined as an open sore found on the surface of the skin, known as the epidermis. People who are likely to develop foot ulcers are those that have diabetes, especially type 2, and those patients whose blood flow is very poor or low. However, venous ulcerations is somewhat different to ordinary foot ulcers because this infection is depicted as open sores and it relates to the blood not being pushed back to the heart by the veins in the leg as to how they normally would do, leading to pooling of blood in the lower limb. The timing to heal this type of condition is slow, since it occurs above the ankle and the leg. How venous ulcers are diagnosed are in the form of granulation tissues as well as fibrin and oedema present on the base of the ulcer. There are ways to treat venous ulcerations with direct methods focusing on treating the ulcer, and indirect methods targeting the underlying condition.
Signs and symptoms of venous ulcers can include the following: shallow ulcers, which are ulcers that may have fewer of the other signs and symptoms on the screen than deeper ones. Edema, which involves excess fluid in the tissues and vessels, typically in the lower limb. Leg pain is a symptom that can occur due to neuronal damage as a result of venous ulcers. Venous flaring involves the showing of small vessels in the skin of the lower limbs and are referred to as spider veins. Varicose veins are similar to spider veins, except they involve larger venous vessels becoming raised and visible. Lipodermatosclerosis is the inflammation of the fat layer of the skin and heavily linked to venous disease. Hyperpigmentation is the presence of dark spots on the skin and could be caused by skin damage via the sun or inflammation of the skin. Atrophy blanche is the presence of white scar tissue located typically where a healed ulcer has occurred. In terms of diagnosing a patient, we need to consider that there are multiple conditions that may cause ulceration, including those relating to diabetes and arterial factors. For the diagnosis of venous ulcers, there must be clinical links between that ulcer and chronic venous disease. These links may involve evaluating primary, secondary, and congenital defects that may cause ulcers, as well as venous blockages or reflux of the valves of the vessels. A medical history is also very important in the identification of etiological factors relating to venous ulcers. These can include a review of past medical conditions, family history, and body mass index test. A Doppler involves ascertaining the ankle brachial pressure index, which can be used to identify or exclude the presence of chronic venous disease and valve reflux. To get a Doppler examination, people can go to the local general practitioner, and so long as there is a Doppler, nurses should be able to perform the examination. The specific pathogenesis of how venous ulcers are formed is not definitively known, though. There are causational with increased pressure in the venous system related to blockages to the venous wall and dysfunction of the venous valves. When blood is not moving up the leg, it causes a stasis of blood staying in the lower limb. This in turn causes an increase in pressure of the venous system and causing the capillaries to lengthen and widen, disrupting their structural integrity. As the capillaries have been weakened and the added increased venous pressure, fluid will escape into the tissue and cause edema. Edema then causes more pressure on the leg tissues, reducing oxygenation reaching the area, leading to tissue hypoxia and capillary death. The damage would most likely be on the inside of the leg, but a mechanical injury may open the lesion of this epidermis and the ulcer completely visible.
Direct interventions of treatment will target the ulcer itself, preventing infection and encouraging natural healing. Preventing infection will constitute occlusive, sterile dressings that cover the foot. To treat a venous ulcer that has become infected, a patient may be prescribed oral antibiotics. The removal of any necrotic tissue will also improve healing time. A study by Bowling in 2007 explored the use of maggot therapy in cases of diabetic foot ulcers as a method of tissue debridement. The results found that the growth of methicillin-resistant Staphylococcus aureus was limited in wounds that were debrided by maggots, indicating that the secretions the maggots produce can be effective to disinfect the wound. In summary, maggot therapy can be an effective tool of debridement and also can be used to disinfect the wound. Indirect methods of treating venous ulceration include alleviating the underlying cause, which is venous insufficiency. Compression therapy is a form of wound care that supports the veins by assisting venous return to the heart, preventing venous reflux, and therefore preventing blood from accumulating in the legs. A popular method of compression therapy is the Una boot, a specialized gauze bandage which is applied from the toes to just below the knee. An experiment by Luz et al. In 2013 investigated the effectiveness of the Una boot on the healing rate of venous leg ulcers by comparing it to a normal foot bandage. The results of the study show that participants using the Una boot experience faster healing rate times of their ulcers compared to those using a regular foot bandage. Lifestyle changes can also be used to alleviate symptoms of the underlying cause, venous insufficiency, and therefore prevent the recurrence of ulcers and improve healing times. According to the NHS, major risk factors for venous ulceration includes those who have advanced age, a sedentary lifestyle, those who sit or stand for prolonged periods of time, and those who smoke or who are obese. Appropriate lifestyle advice should therefore target these risk factors. Exercise will decrease obesity. Further, exercise that targets the lower limb will contract skeletal muscle in the legs that will compress deep veins and therefore improve the return of venous blood to the heart, thus preventing venous insufficiency. Along with exercise, those who have venous leg ulcers should avoid standing or sitting for long periods of time, quit smoking, and elevate their legs regularly.
Each health professionals have the different ways to manage wound. For example, the general practitioner nurse, they play important roles in promoting health and disease prevention. Medical Care Plus is a program that can support the roles of general practitioner nurse to manage the venous ulcers. This shows that this can help the general practitioner nurse can improve skills such as improve the quality of the management. The pharmacist's role is they identify the patients who get a greater risk of developing venous ulcers, and also they remind patients of important treatment as well as how to prevent further complications. Podiatrist's role is need to interact with many specialties to approach manage the wound. Also, they need to work and discuss with the other health professionals to find the best solution for treatment.
We explored that the main signs and symptoms for venous ulcerations involve shallow ulcers, oedema, and leg pain. We summarized that the etiology of venous ulcers as secondary lesions caused by the primary condition, venous insufficiency. From our research, we concluded that the Doppler examination is the most effective method of diagnosis because it will exclude venous disease and valve reflux. In terms of treatment, we conclude that the best way of treatment is indirectly through the use of compression therapy and changes to lifestyle. In terms of the practitioners who take part in treating this condition, we've finalized that a general practice nurse, a pharmacist, and a podiatrist take part, and each one of the professions have their own way of treating this problem.